Hi, my name is Kelly Neal, and today we're going to talk about how to feed your resident. One of the first things you need to do before you feed someone is before you bring their food into if they're going to be sitting here in bed eating, you want to make sure you have a place to put their tray. So I'm going to go ahead and make sure I clear off the bedside table so I'll have a place to bring their tray in. The other thing I want to do is I want to make sure my resident's ready to eat. So when we position our patient to eat, or our resident, we're going to sit them all the way up. They should always be up at a 90-degree angle, so when they're eating, there's less chance that they can choke. I'm also going to bring their tray across so they'll be able to see their food. And now I'm pretty much ready to go get their tray. Now, we've talked in previous videos, we always hand sanitize when we come into a room and when we leave the room. So we're going to want to make sure we hand sanitize on our way out, and we'll go get our tray. So the trays will be brought on carts. Usually they're left out in the hallway. When you're grabbing your tray for your resident, you want to make sure that the cover stays on it while you're bringing it down the hallway, because you don't want uncovered food down the hallway. And the other things you're going to want to grab when you come to feed someone is something for them to wash their hands with, and then a towel for a clothing protector. So now that I have the tray in here, I want to make sure I have the right tray to the right person. So I'm going to check in my card. There will be a card on your tray that has their name and what the diet is and if there's any allergies. So it says here that I have Samantha Smith, and I'm going to check her ID band. Your residents should have an ID band that will have their name on it. You always want to take that time to double check that. If for some reason your resident doesn't have an ID band, you want to ask them what their full name is and what their date of birth is. You don't want to just say, "Are you Mrs. Smith?" Because if they have a history of confusion, they may just say yes, and it may not be Mrs. Smith. We've had that happen before. So I want to make sure I have the right patient, and I also want to make sure I have the right diet. Diets are very important, that you make sure you're bringing the right tray to the correct person. If I have a patient who's a diabetic and they're not allowed to eat sweets, and I accidentally bring them the wrong tray that has cookies and cakes on it, they're not going to tell me I have the wrong tray. They're going to eat it as soon as they can. If I have a patient who's on a specialty diet because they need thickened liquids for swallowing, and I bring them regular coffee, they're going to try to drink it. They're not going to tell you it's the wrong thing. So you always want to make sure you have the correct diet for your patient. So it says here that we're on a regular diet, which means there isn't any restrictions. I'm going to take my clothing protector and put across their chest. And I want to get some hand sanitizer or some water on my washcloth and let them, either I'm going to wash their hands or I'm going to let them wash their hands. Even if I'm feeding them, I always want to do that step. So I want the tray here. I'm going to uncover it, and I make sure everything looks correct to their diet. And the next thing I want to do is I'm going to sit in a chair to feed them. It's more of a dignity issue. If I'm feeding someone and I'm standing over them feeding like this, it makes them feel like I'm forcing them to eat. If I'm sitting here, it's more like I'm having a conversation with them. So when you feed a person, you always want to feed with a spoon, especially if you have someone who doesn't have good upper body control. If I'm trying to feed them with a fork and I'm going down in here and they come forward, I can actually poke those fork tines down in the back of their throat. So I'm going to make sure my resident sees that he has chicken, carrots, grapes, and a cookie, orange juice, and coffee. And I'm always going to ask him what he would like to eat first. So he tells me chicken, so I'm always going to feed with a spoon. So I will give him his chicken, and I want to make sure that I give him plenty of time to chew and to swallow. And this is a good time to just get to know your residents. They have really interesting lives, and they've done some really amazing things and travels. So this is a good time to just sit and have a conversation with them. I'll ask him what he wants next. He wants carrots. So I'm going to go ahead and feed him his carrots. After every 2 to 3 bites, you should offer them something to drink. So we'll give him some orange juice. Now, as far as straws go, the residents are allowed to have straws if they have no swallowing issues. But if they have dysphagia, which means difficulty swallowing, we don't ever give them straws unless it's okay with the nurse. So now he'd like a grape, and I'll give him his grape. And so now let's say he tells me he's all done eating. One thing to note is if you do get this skill for a state competency skill when you test for your CNA certification, you need to make sure you've offered a bite of every food item on that tray. So even if he hadn't had his cookie and he told me he was full, I'd just say, you sure you don't want your cookie or your coffee? If he still tells me no, then it's fine. So he's all done eating, and you will learn at your clinical site as to how to calculate meal percentage and fluid percentage. But now that he's all done eating, I'm going to take this clothing protector, I'm just going to wipe his mouth off. Now, if I had seen any drool or food come down his face earlier, I would have stopped and wiped it up as I've gone along. So now I can take this clothing protector off. Now, I was not wearing gloves for this, and you don't need to wear gloves for feeding someone. Unless they're an isolation patient, you don't need to be wearing gloves just to feed someone. And you don't need to pull the privacy curtain. And then I'm going to go ahead and just, even though I fed him, I'm going to give him the opportunity to wipe his hands again. Now, it's always a good idea to let your residents stay sitting up for at least 30 minutes to an hour after eating. It'll just help with their digestion than to put them down low. So I'm going to make sure he's comfortable, and I'm going to tell him I'm going to leave him sitting up for a little bit. I'm going to make sure he can reach his call light before I go. And now I can go ahead and cover this back up. And we're going to take this out of the room. And I'll take my soiled linen out of the room as well, and I can dump this in the soiled linen hamper as I go out to the hallway. There's usually soiled linen hampers, so I'll put that in the soiled linen hamper. And then this will go back in the trays where they brought the clean food in. After that tray's empty and all the trays are set out, then the dirty trays go back in there. And then we would wash our hands and we would be all done with feeding.